Hello, my name is Justin Walker, and today I will be facilitating this week's Healthcare Leadership Symposium. I will be critiquing the article titled Patient Neglect in Healthcare Institutions, a Systematic Review and Conceptual Model. The authors is Tom Reeder and Alex Gillespie. Authors Reeder and Gillespie conducted a quantitative literature review from Scandinavia, South America, and the US to measure staff, their families, and various patients' observations of neglectful behaviors. Then they conducted another research study in which they surveyed and interviewed several healthcare staff members, their patients, and their families from varying countries to measure their experience and perceptions of neglectful behaviors. The conclusion of the research showed a direct correlation to the topics that we have been covering in the first 12 chapters of our textbook, such as physician burnout, the lack of empathy, and the criticalness of developing trust. Healthcare neglect is defined when a healthcare worker ignores the physical and medical needs of a patient. A popular case that emerged back in 2012 involved a 59-year-old patient from Minnesota's psychiatric facility titled St. Louis Hospital. In this case, the patient, who had a history of epilepsy and dementia, repeatedly banged his head against a concrete wall for more than 3 hours. And in another documented case, it included a patient who waited for over 4 hours to receive care and was later found to have suffered from a stroke. There are several high-profile scandals such as this that has received national attention from policymakers and the media. Author Reeder and Gillespie continued their research study and created a couple main points. One of the main points that the author focuses on is the importance of reconceptualizing the topic of patient neglect. The media, as I said before, the general public, and some researchers on this topic is under several false assumptions. The author was definitely intent to distinguish the difference between healthcare neglect and healthcare abuse. Healthcare abuse refers to the active attempts by employees to cause harm to patients through malicious behavior, whereas healthcare neglect refers to passive omissions that comes from staff laziness. Another main point is that the author differentiated between procedure neglect and caring neglect. Procedure neglect refers to the failing in care that falls short of the institutional and professional standards set by a hospital. For example, this is when a healthcare worker fails to feed, hydrate, turn, or clean a bed-bound patient to follow the procedures that was laid out for them. Several interviews with staffs conducted from the authors show that this occurs when healthcare workers fail to properly plan a patient's discharge, document a patient's injuries, delay their diagnosis, forget pivotal procedure steps such as to wash or feed a patient, and this type of neglect is indicated by a flaw in their system. But this can be objectively measured. So caring neglect, on the other hand, refers to the failure to provide care that leads patients, their family, and the public to believe that the patient is uncared for and emotionally unsupported. For example, this simply occurs when a healthcare worker ignores the request for a glass of water or dismisses a complaint of pain that the patient has communicated. The last point covered by these authors was the various causes of patient neglect and caring neglect. They surveyed and interviewed patients and their families, and the patients and families highlighted the following behaviors because they failed to provide emotional support. Some of these behaviors included patients not being listened to during the decision-making process for their care, failure to show empathy or compassion when in need, doctors failing to communicate properly, staff just being downright rude and nasty, a lack of urgency for providing help, and a belief that staff are unwilling to give assistance with basic tasks such as eating, drinking, speaking, or going to the bathroom. Our class's textbook discusses a lot of these healthcare communication issues, such as the lack of empathy, absence of active listening, failing to develop trust, and to effectively use and implement empathetic responses. These skills can help solve the issue of patient neglect that was researched in this article. As a constructive critique of this article, I would say one of the author's strengths is that they provided an excellent analysis of their research, and they had a very diverse sample. As you can see on pages 4 through 6 of this article, the participants in this sample were very diverse. It included patients and nursing staff from 2 South American hospitals, 80 staff members from 9 German nursing homes, 114 caregivers in long-term care facilities from Taiwan, 661 patients from Sweden, and they also surveyed 616 nursing staff from 16 Norwegian nursing homes, along with a few other sampling clusters. In the realm of statistics, when you have a diverse random sample, it always reinforces the accuracy of the data, and it makes the data that's gathered from the research study more believable and trustworthy. As a weakness of this author, since I'm speaking on the sample, they did not clearly articulate their sample. I can only reasonably assume that they attempted to analyze the issue of patient neglect throughout the entire world. And if this is the case, to analyze individuals and institutions from only about 10 countries, which they did, is clearly not enough. When analyzing a worldwide issue, it should be best to examine the metrics and complexities of several healthcare systems, since the healthcare field drastically varies country to country and culture to culture. In conclusion, this wraps up my analysis of Readers and Gillespie's article, but I wanted to end on a few questions. Question 1. Have you ever witnessed a case of patient neglect? In this case, were you mistreated? Or were you the healthcare worker and or the family member who observed someone who was neglected? Question 2. How can the use of empathetic responses and physician burnout prevention have a positive impact on the patient-provider relationship? And question 3. What policies and protocols in your current company are you taking to prevent cases of patient neglect?